Hi, good morning. Welcome, everyone. We're going to start in a moment to allow folks to enter into this webinar from the lobby. My name is Michelle Cunningham, Marketing and Outreach at Healthcare Workforce Development. We are excited that you have joined us today. Before I begin, I'd like to discuss a few housekeeping items. The webinar will be recorded and posted on our website. This slide deck is currently posted on our website. Due to the volume of attendees, the chat option is disabled. However, there will be multiple question and answer times throughout this webinar, and you'll be able to raise the hand icon to ask your questions. I am thrilled to introduce our first presenter, Karen Rizal, Deputy Director with the Healthcare Workforce Development. Thank you, Karen.
Thank you, Michelle. Welcome everyone to our webinar today. We are excited to be able to share with you our new grant program. And so I wanted to just walk through the things that we'll be talking about today. We'll go into detail into the grant program, things that you need to know about it, how it works, how to apply, how we score it, and reporting information that we require of each awardee. And so we will have plenty of time, we hope, for a question and answer as we dive into the webinar today. So on the next slide, I just wanted to share that this work, that this program is really about supporting the work that we do at Department of Healthcare Access and Information to ensure that we are building a diverse workforce that serves California. And so this program is really meant to address how do we build the behavioral health workforce that we need now to be able to serve the needs and the population that California has now. And so it's really about how do we expand, retain, and train the behavioral health workforce in community-based organizations that are doing the work of providing behavioral health services in California. This is also part of our overall work that we've been doing the past year to support the Children and Youth Behavioral Health Initiative to really serve children and youth 0 to 25 and how we can better provide behavioral health services to children and youth. So with that, I'm going to turn the presentation over to Ann Powell, Health Program Specialist here with Health Workforce Development. Thank you.
Thank you, Karen. I appreciate your introduction. I'm Ann Powell. As Karen said, I'm a health program specialist here at Healthcare Workforce Development. And I'm going to do a brief overview and then turn it over to our program officer. So the eligibility is focused on funding CBOs that we define as nonprofit organizations based in the community that currently provide behavioral health services exclusively or in combination with other health and other services. Next slide. We have up to $100 million available to support this undertaking. So we very much encourage applications for these funds. It's broken into two segments. One is scholarships, stipends, and loan repayments for paid and unpaid employees in exchange for a 12-month service obligation that begins as soon as that individual award is made by the CBO. We also are supporting retention bonuses, recruitment bonuses, and recruitment activities. Next slide. In addition, in order for these grant funds to go to as many agencies as possible, we're limiting support for 25 employees or 25% of agency workforce, whichever is greater. and to clarify, that's behavioral health workforce, as you'll see in the grant guide. Staff selected to receive scholarship stipends or loan repayments need to use our central application to apply, and that information will be returned to the application, to the grantee, who will make the ultimate decisions about who they award these individual programs to. Next slide. The types of grantee settings that we envision include, but are not limited to, are federally qualified health centers and what's called FQHC lookalikes. You can go to this website to learn more about what that is. Community and rural health clinics, mental health programs, substance use disorder agencies, combined mental health and SUD service agencies, and other kinds of community-based organizations. Next slide. I've done a really quick run through here, and so now I'm going to turn it back to Michelle to run the Q&A.
Thank you, Anne. So I see someone's already raised the hand icon, which is great. You'll find this icon on the top of your screen with the reactions button. Once you raise this icon, you'll be placed in a queue. I'll call on you. Your mic will be enabled and you will need to unmute yourself. To unmute yourself, the mic button is at the top of the screen. When you're finished with your question, please mute yourselves and lower your hand icon. We will do our best to answer all of your questions. And as you see on the slide, there's also the email address that you can note and ask any questions in that platform as well. All right, Gary McDonald, your hand is raised. You will be able to unmute yourself as soon as your mic is enabled. Thank you. All right, can you unmute yourself, Gary, please? So to unmute yourself, the mic button is at the top of the screen, or let me just see if I can assist. All right. Gary, go ahead. Okay. I don't know if we're having technical difficulties with that. We'll come back to you, Gary. And Anna, reader N, please unmute yourself. I think we're still having technical difficulties with this. We're going to work on that internally on our end. Let's see, the next hand raised is Claudette.
Hear me?
Yeah.
Great.
Good morning. I cannot see the slides. It's I have a blank screen.
If you want to refresh your page, maybe try that, or on our website, the slide deck is posted under the community base. So if you want to pull that up independently, that might be another way too.
Okay. Thank you.
Thank you. And Anna, if you want to unmute yourself, please. We're going to move on to the next person. We'll come back to you, Anna. Sean Oilu, and I apologize if I mispronounced your name. If you want to unmute yourself, please. I don't know if people are having difficulties with finding the unmute button. Oh. See if we can work internally to assist the participants. All right. Sean, if you want to try to unmute yourself, I'm going to go next to Liberty Franks.
Thank you so much for taking my question. Can you hear me, please?
Yes,
Yeah.
thank you.
Wonderful. So appreciate this webinar and was hoping to get some more specific information about the mechanism of the funding. For instance, are there limits per employee depending on which bucket you're in, the scholarship, stipend, loan repayment versus the recruitment and retention funds? Do you have, if you could walk me through a little more of the specifics, in other words, theoretically, if my organization, which provides community-based mental health services to youth, if we were to submit a proposal and give a budget that said, okay, we want to forgive 25,000 of this percentage of our workforce's, loan repayment, and we also want to supply this however many thousands of dollars in recruitment and retention for X number of employees, would that then be distributed on a multi-year basis? Would that be something that was distributed in a lump sum, and then we in our reporting would be responsible for how we manage that? Can you give a few more specifics and also any limitations about funding per employee? That would be very helpful.
Thank you for that question. I'm going to ask my colleague, John Madras, to possibly weigh in here. But the vision that we have is that let us just use the example of you have 100 employees and therefore 25% or 25, whichever is greater, in this case, 25. Thank you. So we would do that. That would be what you'd be applying for. You decide what bucket you're going to put it into, and we'll then look at how you propose to spend it. And I'm told that Ivana will cover this more in her discussion. Thank you.
All right, we have Anna next. Please unmute yourself. The mic button is at the top of your screen. And that's how you, great. Thank you.
It wasn't working before. I think I was clicking it, but it wasn't unmuting. I just have a question about stipends. Are these stipends for a specific type of activity? So for to further their education, or could they be stipends allocated to a specific project of the organization, or how would that work?
Stipends are done in partnership with an educational institution. A good example might be a social work program in your community where a student is enrolled in their program, and then that individual would be eligible for a stipend. It is education-related expenses, and it's focused on individuals with seeking a master's or doctoral degree in clinical care.
Got it. So all of this funding is really directed towards educational activities or recruitment activities of the agency.
Correct.
Okay,
And
got
retention.
it.
Yeah.
Oh, and retention?
Yes.
And what kind of funding what kind of retention funding?
Bonuses of up to $10,000. Yeah.
Got it. Okay, thank you.
Mm-hmm.
Okay, thank you. I appreciate all your patience with us working internally with the mics and the enabling part. Thank you so much. So I believe Anna asked her question. Claudette has asked her question. Liberty Franks is next. Please unmute yourself.
Oh, hi, you already took my question. Thank you.
Okay, great. Once you're finished with your questions, if you could lower the hand icon, that would help. Next is Hamilton Liu. Please unmute yourself.
Hi. So you made a reference that applicants or staff members who are going for scholarships or loan repayments, they'll have to complete a the central application, and then the organizations will be able to review this information and then allocate the funding. Is there a way that we can preview the application that staff will have to complete?
You can, once we select our grantees, we will share with you that link and you'll be able to see what is collected in the application. I will say that that data is set, but you'll be able to see the collected data and then determine who in your agency you want to fund.
Thank you.
Anna, greater N, please unmute yourself.
Sorry, I think it was me. I need to lower my hand. Sorry about that. You already answered my
Thank you.
question.
Thank you. Grace Park, next, please unmute yourself.
Hi, this is Grace from the Koreatown Youth and Community Center. For the 25% of work, so we're a multi-service agency. Is that 25% of our entire agency or 25% of our behavioral health workforce?
I'm going to defer that question to the next presenter who can go into more detail about that.
Great, thank you, Anne. And our next presenter is Ivana Evans, Program Officer with Healthcare Workforce Development. Thank you.
Thank you, Michelle, and good morning, everyone. Perfect on the right side. So let's jump right on into our award provisions here. So award levels, HCI may award full, partial, or no funding to an applicant based on the applicant's criteria score and the amount of available funds. Geographic distribution. Award decisions will depend on application scoring results and geographic coverage across California. Next slide.
Ivana, you're on mute.
Ivana, you're on mute. Please unmute yourself, Ivana. Oh. Allison, can you assist with unmuting Ivana, please?
Can you hear me okay now?
Yes, thank you.
Okay, so I'll start back at the top of this slide here. So for the budget, a 25 an advance payment equal to 25% of the grant will be awarded upon execution of the grant agreement. Arrears payments, remaining grant funds will be awarded annually in arrears as expenses are incurred. Administrative and indirect costs. Up to 15% of the grant funds may be used for administrative costs. Non-supplementation. Grantees may not use HCI funds to supplement funds the grantee has received from another source for the same purpose. And we also have an example on the next slide. So for our visual learners here, this might help you a little bit with these budget provisions I just mentioned. Next slide. Okay. So in this example we have here, an organization was awarded $100,000 in funding. Upon contract execution, the organization will receive their advance payment of $25,000 to begin their program. The remainder of their award, the $75,000, will be awarded in arrears annually after HCI receives the organization's annual report for services. Up to $15,000 of the $100,000 awarded can be used towards administrative and indirect costs. The $100,000 may not be used to supplement any other program for which funding was received from another source for the same purposes. Next slide. Okay. Program components. The grant period for the program is 4 years and includes undergraduate educational scholarships, clinical master's and doctoral graduate education stipends in partnership with graduate institutions, loan repayments, recruitment bonuses and retention bonuses, and recruitment activities. A resource guide will be available on our website to answer any frequently asked questions regarding these program components. Next slide, perfect. And program component amounts. So the funding amounts for scholarships, stipends, and loan repayments are $25,000 each per employee. Recruitment bonuses are $2,000 per employee. Retention bonuses are up to $10,000 per employee. And the grantees can allocate $1,250 annually to recruitment activities. Next slide. Program provisions. Individual scholarships, stipends, and loan repayments must begin in January and/or December of the following fiscal years: 2023 to 24, 2024 to 25, and 2025 to 26. Service obligations will be awarded individuals must be reported through fiscal year 2026 to 27. Next slide. So on the next two slides here, we have the list of eligible professions and students for the program. So this list was also available in our grant guide for further review. Next slide. And on this slide, we have the remaining eligible professions and students for the program. Again, these are available on the grant guide for you guys to spend more time to look at. Next slide. And key dates. So the grant application was released on September 30th, 2022 at 3:00 p.m. The deadline for applicants to submit their application is November 30th, 2022 at 3:00 p.m. Award notices will be sent out around January 17th of 2023. Grant agreements will execute on March 17th of 2023. And we highly recommend for applicants to review the grant guide available on our website prior to starting the application process. And there's also a PDF preview version of the application for grantees to review as well. And next slide. And I will hand it back over to Michelle to facilitate the question and answer portion. Thank you.
Thank you, Ivana. And I see a lot of hands are raised, which is fantastic. Let's start with Kayla Shea, and I apologize if I mispronounce names. If you can please unmute yourself, and that's the mic button at the top of your screen. Thank you.
Hello, thank you so much for this. Do you anticipate, or what number of grants do you anticipate awarding? Or how many organizations do you anticipate awarding it to?
I have to defer this question to John Madriz. I do believe it is difficult to state the exact amount since program funding will depend on the facility. But John, do you have an estimate available?
We don't have an actual estimate because it will depend on the amount requested by CBOs. So we do know that the size of CBOs range across the state. And so the amount of funding that's requested will vary. It could be anywhere from $100,000 to over $1 million in requests, depending on the size of the CBO. So some of them may be able to award more than 25 employees based on the size of CBO. Most would be 25 and under, and so it will vary depending on the amount that's requested per grant applicant.
Thank you.
You're welcome.
Barbara Garcia.
Yes, good morning. Thank you for taking my question. I did have a question, was if these funds available for just undergraduates or just master's and doctoral degree, but I see that that answer is yes. Are we limited for the master's and doctorate students to receive stipends? And that's one question. And then are scholarships only available for the undergraduates?
So you are correct there. So the scholarships are specific for undergraduate students. So for those who may be participating in a certification or associate or bachelor's degree program. And then those stipend programs are specifically for our clinical masters and our doctoral graduates. And all of these fall into that 25 or 25% of the organization for how many people, how many behavioral health professionals that you can award.
Okay, thank you.
Jody Langs.
Hi, thank you. Is there a maximum grant amount per organization, since some will have over 1,000 employees and some will have obviously much fewer?
No, sorry, I heard a little feedback there. We don't have a maximum award amount. Again, we will be reviewing everybody's budget and we will determine the award amount based on your budget and the number of staff that you have. So we don't have a recorded maximum amount for CBLs.
Sean Boyu.
Hi, thank you for taking my question. I'm sorry, the first time I wasn't able to unmute. It said an administrator had to, so I was talking into thin air. My question is this: with regards to the possibility of looking at this funding opportunity for my staff, specifically with regards to loan forgiveness, this would sort of be a lookalike of the National Health Service Corps Behavioral Health Work Group funding that is available. I was wondering if there were any limitations for those that are folks able to take advantage of both, or is there a rule out that if they're already taking advantage of that program, that this would be part of the calculus or not part of the calculus? Would it intersect or not? Because from my perspective, the thing I could offer would be something very, very similar to that program, which would really help me in retaining staff.
Okay. So typically for HCI programs, we have we don't allow overlapping service obligations. So if in this program they are required to complete a service obligation in order to receive the grant funding, then they would not be eligible for the program. But if they have a service obligation which they could pause while they complete a service obligation with your facility, then they would be eligible for this. So it really depends on the specific program and if they have to complete a service obligation to receive and retain the funding.
Wonderful, thank you.
Nia Castleman.
I'm having a problem with my mic. I wanted to know, like, what are the key points you're going to want to look at as we, write the grant?
So I do believe we'll be covering this in our next section. We'll go over the application details further.
Okay, all right, thank you.
Ken
I'm glad to see peer personnel listed. My question then would be, are there any restrictions on peer personnel or what type of education they're going for? And speaking from the perspective of a recovery community organization, providing peer services for primarily drug and alcohol, but some mental health.
Where are you?
In Santa Cruz County.
Okay. Sorry, there was a little bit of feedback. Could you repeat your question for me?
Right, and thanks, Ivana. I'm going to ask the guest, if you're not speaking, if you could please keep yourself on mute because we have playback and audio issues. Thank you.
Yeah, thank you. Yeah, my question was regarding. First, thank you. I'm glad that peer personnel was listed. I'm wondering restrictions on peer personnel, how you define that, and what type of educational pursuits they can put the scholarships or such to?
I will need to defer this question to Anne or John, since you two were part of the stakeholder meetings. Were there any stipulations regarding the peer personnel?
It's actually, there's two possibilities here. This is Ann Powell. One is that it could be for them to get certified as a peer personnel specialist under the new state certification rules. The other possibility is they may already be a certified peer personnel specialist, and they may want to pursue additional training to advance in their career. And so that's viewed as that's why we have both other licensed and certified and other non-licensed and non-certified personnel as eligible for these funds. I hope that addresses your question.
Juan Garcia.
Yes, thank you for letting me speak. I have several employees that have already completed their degree, but they're loaded up with loans and whatnot. And I'm wondering if this program that you're offering would cover some of those loans. That's basically my question.
Yes, so for those individuals, they could be awarded a loan repayment. So that would be an amount up to $25,000 for that 1-year service obligation. So when you issue their payment, they will then be able to work with their lenders to apply that amount to their student loan. So that should help some of their burden. But I do know some professionals have a lot higher than 25,000, but we hope it does ease the burden a little bit.
Yeah, so that means that I have about 5 employees in that situation. And so if we applied for this program, we would be able to allocate up to $25,000 per year of service so that they could apply it to their loan and work with their lender on that.
Yes, that's correct.
Are they able to apply it to multiple years of service?
I believe it can, or Anne, I see you popped up. Do you want to add in?
If they do, they would count toward your 25. So each year is a new person.
Okay.
Martha Mena.
Martha Mena, I'm with a drug and alcohol services provider in Alameda County. And I think the question has already been answered, but I'd like to double check. So it sounds like as an organization, we can use this money to move our registered staff to certification. We can also help our staff who are already who already have a master's in some field of behavioral health repay their loans as well. I think what I would like a little bit more clarity on is tell me a little bit about how to use the money towards retention and recruitment. What are some of the ways in which we can use those resources?
So the recruitment and retention are primarily used in the form of bonuses. So our recruitment bonuses are up to $2,000 per employee. So if they sign on with you and they begin working and they're in one of the eligible professions, then you can give them $2,000. And this is to assist you with filling any vacancies that you may currently have or expect to have in the future. And the retention bonuses are very similar as well. So you can allocate up to $10,000 per employee. And in our resource guide, I do know that we have recommendations for how to allocate based on like how many years the staff member has been working with your organization.
Thank you so much. This is super helpful.
Renee D. Valeri.
Thanks for saying my name correctly. I get a butcher all the time. Okay, so a couple of questions for you guys. The first one is if the bonuses or the retention bonuses and all that, is that only to be allocated to direct service staff, or could we also take into consideration like our QA team, managers, et cetera, et cetera? That's one of the questions. And then, hold on, I did have a second one. No, never mind. Then let me just go with that one.
Okay. So for the recruitment and retention bonuses, they would be in the behavioral health section of your organization. So anybody who's working in that unit specifically, and Anne or John, feel free to jump in to add any information to this, but
and again, so it would be direct service providers.
So only direct service providers.
yes, so it would be those working directly with your behavioral health clients.
Okay, sounds good. Thank you.
Gail Russo Larson.
Much for taking my question. I'd just like to clarify whether the multi-year aspect, how that is considered. So for example, say we have 25 employees that are eligible. Do we then calculate our budget and write the grant so that we can perform, take advantage of this funding ×3 for each of the fiscal years in which the funding is awarded? And then say, for example, we were awarded for 3 years and we were awarded 300,000. Do we then allocate it 100,000 per year within, I don't know if I'm making my question clear. Do you understand what I'm trying to understand?
Yes, I think I have an idea. So if you want to award somebody multiple times, it's they would be counted twice. So if you want to award somebody twice, they would be considered 2 of your eligible staff. So if you have 25 employees and your organization is at and you only have 100 employees, for example, within your organization, your cap is 25. So you would only be able to award everybody once. But if you have more employees, you have the flexibility in that aspect. So if you have somebody who may not be interested in the program, you could potentially use their slot to award somebody else an additional time. So it's a little difficult in that manner, but they do get added again for each time they're awarded to the cap of your amount, if that makes sense.
I'm sorry, I'm still not clear. Does that mean in each year we can allocate funds to 25 individuals, and each time we allocate, it doesn't matter which individual it is, it's a cap for 25 per year? Again, assuming we have 100 who qualify. I mean, we have 100 behavioral health providers, or does it mean 25 slots for the entire period, the entire 3-year grant period, that must then be allocated over those years?
It's the latter.
I see. So a maximum of 25 over 3 years. You could do 5 1 year, 10 1 year, 10 another year, but a max, I understand, assuming 100 employees. My last question is, are there stipulations for the period of time in which an employee must stay with the organization if they've received either a recruitment or a retention bonus? What happens if you pay them a recruitment bonus and then they leave?
So our service obligation for the program is a year to receive funding. And we did leave this part up to the organizations to determine what consequences they would have to, what an individual might have to go remedy or to receive in order to pay back any funding if they did not complete their contract and meet that 1-year service obligation. But typically, they should stay with the organization for at least a year if they are receiving any funding from this program.
Wonderful. Wonderful, thank you. And it is paid to the organization in arrears, and we potentially pay it out to the employee before we've been recompensated, correct?
Yes, that's correct.
I understand now. Thank you very much.
Thank you. We're going to be entertaining questions for the next 5 minutes before I introduce our next presenter, and then we'll have another Q&A session at the tail end. Please continue to raise your hands. Next is Connie Early.
Hi, thank you for calling on me. I had a question about something you just said, and now I can't remember what it was, and you may discuss this a little later. I had a few questions about the actual application itself, which we've looked at. Are you going to come back to that, and should I wait or ask now?
So, we will be covering the application more in our next part of the presentation. So if you could hold your question, if it doesn't get answered, if you can raise your hand again, that would be perfect.
Okay, thanks. Let me do that. All right.
Seth Brimhur.
Can you hear me?
Yes.
Okay, great. Couple of questions. So when we're counting the eligible employees in the behavioral health sector, should we then only count those that are actually in direct service, just as the awards are only for those in direct service?
Yes, so your number of employees should be based on the number that are providing the direct services.
Okay, and then a couple other questions, you just kind of relating to a past question that was answered. Can we then decide to wait to pay employees that stipend or that bonus until after they've completed the year of service with our agency? Can we choose to do that to ensure they've completed the year long term?
Yes, so it's up to the organization to determine when they would like to award. So if they would like to award upfront before the service obligation, they can do that. Or if they want to award at the end, they can do that as well.
Great. And then my last question is with the loan repayment. Does that also determine on the agency of whether that year obligation is through the agency or just paid up front and they need to work for a year within the field? Does that differ with the loan repayment?
No, it does not differ with the loan repayment.
Okay, great. Thank you.
Shannon L. Garza.
Hi, yes, I have a question in regards to the requirements for the educational institution for the master's students and their stipends. Does the educational institution have to participate in any way in any programming? Or do we just have to have an MOU to receive students from the institution?
I will need to defer this back to Anne. There we go.
Hi.
Thank you, Anne.
And again, yes, you need just the MOU. We're not asking you to have them actively involved in your work.
Okay, wonderful. Thank you.
Jen Reed.
Hi, thank you very much for taking my call. This is a little odd. Just wondering as far as any use of these funds for, we have an educational institution within our organization, and can providing those services be part of kind of a recruitment or, like an educational element, just a small part. I would be writing for kind of different components of this grant, but just wondering if there was an allotment that I could ask for to pay for the provision of like CEU or particular classes or it's a postgraduate level. Is that part of it? And did that make any sense?
I think I will have to defer this back to Anne again. So.
Hi, I'm back. So if I understand your question, you're saying you want them to take coursework that furthers their skill set for the job. If I understand that correctly, that is what some of the scholarship funds can be used for.
But it would be us teaching it, like our institution taking those classes. That's what I was wondering. So not necessarily San Francisco State, but the institute within. So it would have to be an accredited organization, I'm assuming then.
Yes.
Okay, thank you.
All right, thank you. We're going to close off this Q&A session, and please keep your raised hand icons up. We're going to work to get to all your questions in the toward the end of this webinar. And I'm going to introduce next Kevin McIntyre, data analyst with Healthcare Workforce Development. Thank you, Kevin.
Good afternoon, everyone. Thank you for joining once again. So I'm going to jump right in. So I'll be going over the key application information within the CBO Behavioral Health Workforce Grant. So Medi-Cal threshold languages spoken by the CBO staff. The Medi-Cal threshold languages will be listed within the application. The overall staff race and ethnicity reflective of the communities served. Percent of children and youth served within the CBO. Number and location of program sites. Size and general makeup of behavioral health workforce, number of staff to be targeted for grant funds, strategies to recruit and support staff from underrepresented communities. Next slide, please. This is the second slide for continued key application within the CBO app. Oh, can you go back, please? Thank you. So strategies to serve individuals in underrepresented communities, strategies to assure cultural responsive care is provided, grant activities, timelines, including which specified award cycles to be used by the grantee, the proposed budget, and make sure that you sign and upload your STD 204 form within the application. Next slide, please. So this is the scoring criteria. You can also find this within the grant guide. The Medi-Cal threshold languages spoken by the CBO staff. Once again, that will be listed within the application. Payer mix at service sites. Average mental health HISPA scores at service sites. We will have that be grading that based off your address provided. Children and youth 0 to 25 years old served at service sites. Presence of service sites in rural frontier areas. That will once again be based on your address. Next slide, please. SUD prevalence scores at service sites. So this, just to emphasize, is only for SUD CBOs, not just SUDs. Strategies to recruit and support employees from underrepresented communities. Workforce in areas of unmet needs strategies. Strategies to implement cultural responsive care training into the program operations. Next slide, please. So you're also required to receive ongoing funding, an annual report that will be sent back to us. It will be due July 31st after each fiscal year. And within this report, it must include, will include numbers and socio-demographic characteristics of grantee staff receiving each type of support, expenditures and changes in annual budget within total grant amount awarded. And HCI will send this via online for reporting the required information. Next slide, please. And I'll send this back to Michelle for questions.
Thank you, Kevin. And I see next in line, Hamilton Liu. You'll just need to give a moment for our internal to, there we go. Hamilton Liu, please.
Hi. So you went over some of the application highlights. In the application portal, there is a reference to a PDF of the application for us to preview, but there isn't a link. Is there a way that we can access that application preview PDF?
I will have to defer the.
It's on the website now.
Thank you.
Mia Cooper Khan.
Hi, thank you for taking my question. I am wondering, I'm with Alameda Health Consortium, a regional consortium of clinics here in the East Bay area. And I was wondering if regional consortia are eligible to apply on behalf of their member FQHCs, or if our FQHCs have to apply directly themselves.
I'll have to defer this one to Anne, I believe.
Hi. So it depends, are you a 501c3?
Yes.
Okay, technically you could apply. And you would need to fill out the information for all the sites that it would apply to. Given that that's an urban area, we would encourage you to consider having the larger FQHCs apply directly because of the multiple sites involved. Otherwise, you're going to be putting in up to 150 sites.
Thank you.
Joe Naki?
Hi, thank you. I apologize. I'm kind of pinch hitting for this. Our grants manager couldn't make it today. My question was about eligibility, kind of going back to the very first section. Our nonprofit, our CBO, is a homeless service provider that contracts with behavioral health or county behavioral health. We don't provide direct SCD or mental health services. Would we even be eligible for this grant opportunity?
No, you would not. You need to be providing direct services.
Thank you very much.
Bonnie Alexander?
Thank you. I just wanted a clarification on some earlier slides about the budget. On that first budget slide, you said that these funds cannot supplant other funding received for these programs. And on the second slide, it says you can't supplement funds, and you've got another bit of language around non-supplementation. Is that just like a little mistake in verbiage perhaps, or is it not possible for these funds to supplement some sort of program that is already in place?
You can supplement, you just can't supplant.
Cool. Thank you so much.
Thank you. Enjoying this robust conversation. And just a reminder, if you're done with your questions, if you could please lower your hand icon. Grace Park.
Hi, for direct services, is there a percentage? Like, do they need to be 100% client serving? Could they be partial?
I think if you could, we will have to take that under advisement. And you can, there is a place in there for a narrative where you can describe the makeup of the staff that are not full-time committed.
Okay, and then a follow-up to my previous question, when we're calculating the 25%, was it our entire agency workforce or 25% of our behavioral health workforce?
25% of your behavioral health workforce.
Thank you.
Nia Castleman. All right, we can come back to you, Nia. Juan Garcia. Juan, we can come back to you. Next is Julia Scalise.
I have a couple of questions. You actually just answered one of them. So it's 25% of our behavioral health workforce. So a couple of just housekeeping kinds of things. I'm having a little difficulty, I'm sure I'm just missing it, finding where the grants guide is. And also, where will the slides be posted after this? Because these are very informative and helpful slides. So I went to the website there, the BH programs at HCAI, and I found where to apply, but I can't find where the grants guide is. And there's actually a reference on that page to review the grants guide, which I certainly want to do. So in addition to those kind of housekeeping ones, my other questions are, so if we have a staff who is also a student, like working toward their advanced degree, we can use some of this money for scholarship to support them. Does that trigger the service commitment as well?
Kevin, I can answer the first question about the web page.
Okay.
So grants, behavioral health programs, and if you just scroll down to where it is listed, community-based organization, behavioral health workforce grant program, scroll to where it states application dates, and then under resources, there's the grant guide, there's the webinar meeting materials.
Okay, can you tell me I guess I'm sort of lost getting to that landing page. I went to the BH programs at hcai.ca.gov, and that's sort of where I got lost a little bit after that.
Okay, so you can go to the home page. Sure.
Okay.
You can go to the home page under loan repayments, scholarships, and grants, hit the grants button, and then it'll take you to different tiles. And hit the tile behavioral health programs. And on that page of behavioral health programs talks about the community-based organization, behavioral health workforce grant program. And there's different application dates are listed, resources are listed, which include the grant guide, the webinar meeting materials, and the soon to be posted this webinar recording.
Okay, so, well, I'm sorry. I really apologize, but I'm still lost. So I go to the grants and grants for organizations. Is that right?
Yes.
Correct.
Okay, then when I get there, I get a lot of news icons. Am I in the right? Okay, do I scroll?
100%.
Okay, thank you. And then where do I go after that?
Then you scroll down, you'll see 4 tiles.
Yes.
The second tile on the right is behavioral health programs, and you hit that page, and that's the landing page for this program.
Okay, so I see the Children and Youth Behavioral Health Initiative. I see the webinar for this, and I see the workforce grant application is open, and that's the only things I have.
And continue to scroll down. Okay. And you should see item number 1. That lists community-based organization behavioral health workforce grant is item number 1. Okay. Click on that. It'll bring you down to the page, which talks specifically about this CBO.
Great. That's great. And that's where these will be. So when so we're allowed to have 25 of our behavioral health workforce, or percentage of if it's larger. And so that is whatever category we choose to apply for, and can we kind of mix and match? Can we say there's 5 we want to help with loan repayment, there are 10 we want to use for retention? So is it kind of a place where you can match what your staff's needs are, I guess is what I'm asking.
I'll defer to Ann, but I believe so.
Okay. Yes, you can mix and match. The idea is to give you different strategies for recruiting, retaining, and improving your staff skill set.
Okay. That sounds good. So staff who are students, we could do scholarship. Staff who may be working at graduate programs, we could do a stipend, we could do a retention, and we could do a recruitment.
Correct.
Based on what our staff's needs are. Okay.
Yes.
That's good. Thank you.
Okay. Thank you, Julia. And I really appreciate the information, the question about the webpage and how to find details about this program. Thank you. We have about 25 minutes left for Q&A, so keep raising your hands. Naomi Novak.
Hi, thanks for taking my question. I have 2 questions. One is just to clarify. So if one of our staff that we've counted in our behavioral health numbers, we give a recruitment bonus to, then they wouldn't qualify for, say, another category. We could only pay, basically they could only count once, or if we, how does that work?
Technically, you could have multiple awards to them, but that's multiple positions in your count.
Okay, so we just have to, so it's not necessarily staff specific. We just have so basically in our count, we could count one staff that's 25,000 loan repayment, but then another one would be the $2,000 recruitment bonus, that would count towards another slot of the 25%.
It would.
Okay. Okay. And then the other question I have is just, I know this is going to be asked by our CFO, is how long do you anticipate the reimbursement process to take? Like once we submit our annual report, like, you know, because sometimes it can be a lengthy process. So I'm just curious to know if there's been thought or questions around how long it will take to get the reimbursement.
I would defer to John Madriz for this.
Good afternoon, everyone. Typically, it takes, and this is John Madriz, one of the grants manager section chiefs. Typically, it takes about 45 days for payment after the report has been submitted and reviewed and approved by us. So we aim to process the payments as quickly as we can. This program does allow for some advanced funding once the grant is executed. But for the annual report, it's typically around 45 to 60 days for you to receive payment.
Okay, thank you.
You're welcome.
Jody Langs.
Thanks. Just a couple quick questions. One, I see that in one place, it says 1,500 per new employee for the signing bonus, and then I also saw 2,000. So just wanted to clarify which one that was, or if those
I
are
will
two.
defer to Ivana or Anne for that.
The recruitment bonus is $2,000 per employee.
Okay.
Up to.
And then
It's up to $2,000, so you can provide less.
okay. And then, because I'm just looking at page 19, it says up to 1,500 per new employee. So maybe, I don't know if that's referring to something different. So just want to make sure that's the same amount of funding, pot of funding.
Yeah, so in our grant guide, I do see here, it does say $2,000 per employee in here. And then we also have the $1,250 annually for the recruitment activities that the organization can use. So these for if you use an online hiring service, you can use that funding, $1,250 for that.
Okay. And then, because there's on page, I'll just email this rather than taking up all the time. Just one thing I guess I want to make, I'm sure I'm clear on is that this can't be used for clinical supervisors who, that's a huge workforce gap and shortage for us. So they're supervising ASWs, for example, who can't provide services without a clinical supervisor, but are not technically providing the direct service. So they're excluded.
I will need to defer to Anne if frontline supervisors are eligible for this program.
So first, let me address your question about the 1,500 per new employee. That was in the draft grant agreement, and that is under revision. It will be finalized by the time we do make grant awards, and we are budgeting as though it's 2,000 per new employee signing bonus. Regarding the clinical supervision, we are hearing a lot that there is a big need in that area, and we are attempting to design a strategy to address that separately.
Okay, thanks.
John Balutz.
Hi, thank you. What is the definition of a behavioral health worker? Is it based on their degree? Is it based on their role? How do we, I haven't been able to find in writing how you're defining that. Thank you.
It's behavioral health personnel serving clients. So it could be a clinician, it could be a peer counselor, it could be a navigator. The idea is that serving somebody with a behavioral need, attending to that need, whether it's a mental health and or substance use disorder condition. And if they're not a prescribed, if they're not in that list, so to speak, of professions that we include in the grant guide and that you will see in the application, we ask you to tell us the title of the individuals that you intend to provide that assistance to.
Thank you.
Karen Germain.
Hi there, thank you. Couple questions. There was a slide that referred to children 0 to 25 being served at service sites. We do a lot of community-based services where we meet clients where they are. Does that qualify? And those staff are based out of sites, but they do most of their work out in the field. Does that count?
Yes, it does. As
Right.
long as they're employed by your agency, that's what matters. And where you figure their home base is, so to speak.
Fantastic. Couple more things. The stipend use, does that count if we have staff who attend, in other words, supporting if they attend, like an educational conference or some additional training away from our agency, not necessarily connected to a major educational institution, but somewhere where they are going to earn CEUs and so forth, and the cost associated with that. Is that stipend use okay for that purpose? And if there are any parameters around that specifically, if you could describe, that would be great.
That's what you're describing would be an activity funded with scholarship funds.
Oh, that's not stipends. Could you clarify then the stipend use, the parameters around that, how that would be described or understood?
People pursuing a master's or a doctoral degree to provide clinical services.
Okay, thank you. And then the final question kind of piggybacks on something somebody else just asked about recruitment activities. So that's $1,250 annually. Is that then not connected specifically to the head count? And what kind of backup do you need to justify that funding use? In other words, do you need us to submit receipts or, payment, proof of payment for recruitment services we use, or an event that we might host, the cost of a recruitment event, that kind of a thing? That would be helpful to hear more.
It is not associated with the count. And I will defer to the grants management team on the documentation that's necessary for billing.
Okay.
Ivana or John.
And I will separate.
Hello, this is John. There will be an annual report, an online annual report that all organizations, all grantees will be required to complete. In it, you would indicate all the expenses and any details regarding the costs for different types of activities or events that will be provided to us through this online annual report. We always have the option to request for receipts or substantiation, but for the most part, this will be an online report where you would list all the program activities and the costs associated with those activities.
No.
Got it. Thank you so much. That's helpful.
You're very welcome.
Thank you. And just a reminder, if you're not speaking, please keep your mics on mute. Thank you. Gordon Richardson.
Hi, most of my questions got answered. So one last question. On page 7 of the grant guide, or at least the version that I've got, it refers to 25% of the total budget could go to administrative costs. And then in the budget template, it says that those costs can't exceed 15%. Can you just confirm what the allowance is?
John or Ivana, yeah.
The allowance is 15% for the budget. So the grant guide online will be updated with this information.
Okay, thanks.
Adrian Shilton.
Good afternoon. This is Adrienne Shelton with the California Alliance of Child and Family Services. And actually just wanted to reiterate a comment and recommendation from a colleague earlier about the need for to include clinical supervisors in this strategy. This is a significant function in the CBO workforce. And so we would just encourage HCI to consider that and also look forward to discussing with HCI in the future other strategies to support clinical supervisors as well.
Thank you for that. And we are definitely developing a response to that need.
Thank you. Nick Zong?
I have a question that kind of goes back to similar to like what the fundings can be used and like what kind of classifies as a direct service provider. So for our facility, we are a CCBHC as well as an FQHC, and we do have providers. So our case managers does things like direct outreach to patient and patient families, and as well as to face-to-face case management. And part of the case management work is sort of like clinical education as well as preventative care. Would that count towards direct clinical service?
Yes, it does. And you'll note in the list on the grant guide, it says caseworker kinds of personnel.
Okay, and I'm sorry, when you guys were initially talking about how and like the kind of breakdowns of how to use the funding, I kind of lost connection for a minute. So the fundings we have like things such as recruitment bonuses, stipends, and things like that. And can the funding be used as like direct salary or payment towards clinical staff?
Are you talking for loan repayment or are you talking about augmenting a salary?
In terms of augmenting salary?
It does not cover that activity, no.
Okay. And I guess in terms of workforce retention, like what are some examples that that would fall under this category?
That would be retention bonuses of up to $10,000. So if they've worked a year or more in your agency, you can decide if you want to award a retention bonus to select employees.
Okay, thank you very much.
Connie Early?
Hi again. The more things that come up, the more questions we have. You mentioned earlier HPSA scores by site. This is one of my questions. I have two. We are looking to go hybrid wherever possible as time goes on. And if this were to cover 3 years, would that matter to this? Assuming that we had 25 employees throughout all 15 of our sites, also, does the application have room for all of that for us to continue to put more sites?
Yes, the application has up to 150 sites. So you could, if you're providing direct services, you can provide that address for each of those individuals that you're referring to. Does that answer your question? And that's how we would look up the score.
That's one. And then what is an HPSA score and how would it matter if we say we put in 15 sites and by the time this grant is done, we're down to 12. 3 of those have been, everybody's been moved into the other sites from 3 of them. Would that matter to this?
So you're saying that you moved some of the sites around?
We want to close a few of these and move our staff elsewhere, so into existing sites.
So the application is a moment in time. So if you have 15 sites, we base your score on your locations of the 15 sites. That's one scoring element. We do not go back and readjust based on changes in your program.
Okay. What my other question then too is the 15, and maybe the application and the grant guide says this, but the 15% admin, what will that cover? What can we use for that?
Any indirect costs.
Okay. Thank you.
Liberty Franks?
Hi, thank you for taking my question again. I apologize for being redundant, but I do have a question from slide 15. Again, just reiterate, it says that recipients need to begin individual scholarship, stipend, or loan repayments in these 3 fiscal years. Does that then preclude existing employees that we have who have already begun loan repayments based on however long ago they graduated? In other words, just to have it said once more in black and white, would we be able to use loan repayment funds for employees who started their loan repayments long before fiscal year 23-24? Thank you.
So for slide 15, it's basically for the program. It's telling you when you would start on their service obligate. So they would need to be awarded in June or December of fiscal year 2023-24, 2024-25, and 2025-26. It's not when they acquired the loan. If they had loans from 10 years ago, that they are still eligible to receive funding for, as long as it is an educational loan. Does that answer your question?
Yes, I just wanted to make sure we be able to use it for existing employees, not just new employees that we were hoping to hire. Thank you.
Eric Becerra.
My question, I have two, just to follow up to confirm because of paranoia. So if I understand this correctly, we can use a hiring bonus on one employee and then still provide like a retention bonus or another category for that same employee?
That is correct, but that employee would be counted twice in your number of employees. So if you are at your 25 limit, they would be 2 of that 25 employees.
Got it. Okay. And that leads me to my next and final question, which is the 25 employees that 25 or 25% of employees, that would be our current employees, not the ones that we're also counting for like retention or estimating would be part of this retention.
So for the 25 to 25%, that's within your whole behavioral health section of your organization. So it's all 25% of all your behavioral health workers, and the retention bonuses are also a part of that 20 to 25%.
Okay.
So they're not separate.
I think that's where I need clarification. I think I'm confused of with the retention. Is that including the 25%? Is that included in 25% of the, I mean, for the recruitment, is that included in 25% of our current employees or what we estimate our behavioral health services would be after recruitment?
I would have to defer to Ann. I know we do ask on the application your vacancies.
It's current employees.
Okay, great. Thank you.
Mark Rukdashel.
I had a question. I've been looking at the grant guide and listening to this conversation and just want to make sure I have this correct. The retention bonus for a non-drug and alcohol person, they would have to have 5 years of service, and then if they're a drug and alcohol person, it's just 1 year of service. Am I reading that correctly? There seemed to be a difference between. I'm now trying to find the section again.
It's on page 7 under budget conditions. Yes, that's correct. There is a severe shortage of SUD workforce, and so we are trying to emphasize retention bonuses for that workforce.
Okay. And the 25 people or 25% is for the entire, covers the entire funding request, not only stipends and scholarships, but also the recruitment and retention. Just confirming that, correct?
Yes, that's correct.
Okay. All right. Thank you so much.
Kimberly Valenzuela.
Yes, so for the direct care behavioral health staff, is there a minimum number of hours that they need to be working? Like, do they have to be full-time employees to qualify for one of these?
Say your question again.
Is there a minimum number of direct care hours a week? So like I know some of the previous grants have required 32 face-to-face hours with clients a week, and some have been 20 hours.
I think we considered a similar question earlier, and what we would ask you to put that in your narrative so that we can understand what your workforce, what the hours are in order to figure out that count.
Okay. And then my second question is, I just want to confirm, it sounds like if you are if your agency has multiple sites and in particular is in multiple counties, it's still one application for the whole agency?
Yes, it is.
Okay, thank you.
Elena Cantor.
Taking my question, I'm sorry to beat this one, but it's also about the issue of clinical supervisors not necessarily being included as direct service staff. I do have some clinical supervisors who are providing mental health services directly, as well as providing clinical supervision. So how would we suss out their time in the application? And then also in their role as clinical supervisor, they may also need to step in and support clients in a direct service manner. Let's say one of their supervisees is out of the office, or there's a clinical crisis that needs their level of involvement. So how do we think about that?
So we're not supporting operations. We are supporting retention and recruitment, and then the training and education of the workforce. So at this time, we do not, under this grant, provide support for clinical supervision. However, we definitely recognize that need and will soon be attending to that issue separately.
Juliana White.
Hi, I also have a similar question related to that clinical supervision piece, and I'm not sure if the last question was actually answered thoroughly. So my question is also, we have many clinical supervisors who are providing clinical supervision. They're also supervising behavioral health programs. As a part of their role, they do carry a caseload providing direct services. We also have many clinical supervisors that provide on-call services after hours. So they might not be directly working in a behavioral health program for their day-to-day Monday through Friday, but they are providing on-call services after hours that can directly serve those behavioral health clients. So would those type of staff qualify in our count of eligible staff of the 25%?
If you are intending to provide one of the activities of retention bonus, stipend, scholarship, or loan repayment, all that we require is that they provide some direct services, and that you describe that for less than full-time in your narrative.
Okay, great. Thank you.
Laura Keller.
I just had a question back to slide 12 about there was like a budget example. And I'm just trying to understand kind of like the 4-year time period. So like if we had 4 employees, so say we're getting 100,000 in funding, and then there were like 4 employees that were getting the 25,000 loan reimbursement, would then each of those kind of get like a quarter of that each year? Like, would they need to work for us for 4 years to get the full 25,000, or how would that work? Or would it be all given up? It's divided each year for 4, it's spread out across 4 years, or can you explain that a little bit? Or can you get it all up front?
So you decide how you want to allocate, how you want to just disseminate the funds that you decide to award to individual employees of your agency. If you want to do them upfront, over time, or at the end is your decision.
But do we only receive a quarter of it the first year, and then after the report, the second year you get another quarter? Is it a quarter of it each year is what the organization receives, or?
Ivana, do you want to talk about arrears?
Yeah, sorry, maybe I'm not understanding that concept. That'd be helpful. Thanks.
Yeah, so it's based on the annual report that you receive. So if you if you allocated all your funding within the next year, then you would receive funding. So it's based on that annual report that you submit to us stating how much money you have allocated to the program already. So that's our, it would be 1 year after, so that's the arrear. So, but if you received your $25,000, you spent that, and then you spent an additional $75,000 and you submitted the annual report stating so, then you would be able to receive that funding.
Oh, okay. Got it. Thank you.
Hamilton Liu.
Hi.
Hamilton, you want? Oh, there you go.
Yeah, sorry. So if I saw on page 19 of the grant guide that HCAI might convene a statewide CBO meeting. If this occurs, are travel costs, are they supposed to come out of the administrative costs of our budget, or is it going to be just reimbursed by HCAI, or how do we account for this in our budget?
Don?
Hello, this is again John Madriz. In the budget itself, anything other than the cost for scholarship stipends, loan repayments, recruitment activities, bonuses, and so forth, anything in addition to that would be covered under administrative costs. So in the sample grant agreement, we have a list of different items that would be covered under administrative costs. And so if you have travel expenses within the state of California, they're specifically related to this program. Mind you, it has to be related to the program activities under this grant program, then it would be covered under administrative costs.
Thank you.
You're welcome.
We have 1 more minute to the end of this webinar. I'm cognizant that there's 4 more hand raised. Would like to carry on. If that's okay with the team, I'm going to call on Seth Krummeyer.
Yeah, thank you. Just really quick, for the retention bonus, there's the 5 years of service required. Is that 5 years of service at the agency or in the behavioral health field?
With the agency.
Okay, thank you.
Judy.
Can you hear me? Thank you for this very informative webinar. I would like to confirm the following scenario is feasible under the grant. It's FQHC, urban FQHC, who is interested in and has a university partner, an MSW program. And hypothetically, we would like to host, be a field placement site for 5 students, MSW students, either combination of first and or second year. And we are interested in applying for stipends for this purpose, to support those students. I would like to confirm this rather simplistic scenario that it is feasible under the grant.
Yes, it would apply.
Thank you.
Erica Gallo?
Thank you. I just have a very quick question. Where can I find these slides? I checked on the site and I cannot seem to find them. So I don't know if you have it published.
It's on the website under behavioral health programs. If you work your way through from HCI's main website.
Great. Thank you so much.
And our last question with the hand raised, Julia Scalise.
Thank you again. So just two quick questions that were sort of follow-ups to some of these. So the arrears, I'm sorry, I just got an email. Should we be budgeting for the full 4 years then, and then parcel this out annually? Or one of the scenarios was just that you kind of use the money in the first 2 years. I mean, should we plan for this to be a 4-year ongoing grant request? And then my second question is, can you just again repeat for us about the number of years people need to be at the organization? And is that across the board? Is that for retention as well as scholarships?
The 5-year minimum is for retention bonuses of up to $10,000.
Okay.
The question you have about, could you repeat the first question?
Sure. So someone had asked about the arrears payment, and then the scenario was if we spent 25,000 and then spent the other 75 in that year, and that's our 100,000, then the program is over in that first year. Or should we see this as budgeting it out across the 4 years of the grant period?
That's really your prerogative to decide how far out you want to go in the 3-year of active programming. The 4th year is really a wrapping up with not new program activities, but with the billing and administrative functions, in particular, the 12-month service obligation.
Okay. Oh, of course. Thank you. So when we talk about the 5-year, this sort of, they all kind of tie together in that. So if we have someone who's with us for 3 years right now, and so in 2 years, they would be with us for 5, and they would count for that retention bonus. So we can plan ahead like that in terms of identifying and allocating potential retention bonuses.
Yes, so it serves its purpose of encouraging people to stay with you.
Right. Thank you. That's what I thought.
All right, thank you. We'll entertain one more question. Catherine Eisenhower.
Now made me have a question. So you had just indicated, like we have many student interns working on their MSW, you know, or MFT from different universities. Now they're technically, they're not our employees. They're, you know, just placed with us in order to do their internship. But I thought I heard you say that they would be eligible for stipends. I just want to clarify that.
We're assuming that they are an employee. They may not be paid, but they are under your employment.
Okay, so then in our total count, we can also count those interns. Is that correct?
Correct. As part of your 25 or 25%.
All right, thank you very much. I'm glad I asked.
Thank you. Thank you, participants. We appreciate all these questions. We're going to go ahead and wrap it up. And if you have questions, please note the email address on the screen and feel free to reach out to us in that direction. I'm going to reintroduce Deputy Director Rizal for closing comments. Thanks again.
Well, thank you everyone for attending this webinar and for engaging with us as we offer this first grant application. We're looking forward to we were excited to be able to put this out there, and we hope that many of you will take advantage of this opportunity. And I just want to note that we did post our email address if you have any questions. I just wanted to just kind of go over some fundamentals as well, that the application is open through the end of November. And that we do have on our website, and with these slides, you can see the links directly to the PDF application, the online application, to take you directly there for further information. I also just wanted to point out that we have other programs that we offer, loan repayment, scholarships, grant programs, and just that we have an eligibility quiz that we have on our website that anyone can look at to say what other types of funding might someone be eligible for. And so using that eligibility quiz will help provide some information about other funding opportunities that HCI would have. Next slide. And that is just that we thank you again for attending this webinar. Also, that if you're interested in being receive our monthly workforce programs update that we send out with information about all of our programs, we have the URL for the mailing list, and you can sign up and receive information on programs as we are opening them. So thank you so much for all of the engagement, and we appreciate your time.